first of all, thank you so much, Dr. Eusebio, for joining us today. I know that you've had some comments which have been read and shared by hundreds of people regarding the response to COVID-19. So, I mean, I guess we can just get into it. Can you share with us some of the thoughts that you've been kind of considering and lobbing about?
My concern actually began with the death of the nurse. She's been in the hospital for several weeks and had negative COVID tests until the week she died, when she turned positive. And to me, that indicates that that she acquired the virus during her hospitalization. So if she acquired the virus during her hospitalization, then that means that there is a risk or increased risk of acquiring the virus during your hospitalization. Now, what we're doing is those patients that are symptomatic, or those patients that have been found to be COVID positive requiring hospitalization, are being funneled to GMH. So we're telling the public that if you're sick, you need to go to this hospital and you need to be taken care of in this hospital. Yet we're not being informed in regards to what is the risk for that patient of acquiring the virus. If the patient, let's say, turns out not to have a COVID infection, what is their risk of acquiring the infection? My suspicion is that the risk is a lot higher than being out in the community, certainly. And if it is, then what are we doing about it? What is the hospital doing about it? I'm concerned about patients currently who do not have the infection yet are in the hospital. So if the risk of being in the hospital is increased, the risk of getting the COVID infection is increased in the hospital, why are you keeping those patients, specifically the pregnant patients, OB patients, the pediatrics, those little kids? Why are you keeping them at GMH? It's not like you don't have any other options, because you can take those same patients and transfer them to GRMC. Why aren't you doing that? Why are you increasing the risk for those patients and keeping them there? What's the reason? So I'm concerned about that as a physician in the community, as a physician who takes care of a lot of these patients. I need to know.
Right. And have you raised your concerns, sir, with Guam Memorial Hospital, or have you reached out to perhaps Dr. Cruz or Dr. Cabrera, who or even Dr. Nguyen, who lead the physicians group?
I've reached out to Dr. Cruz. I've reached out to Dr. Cabrera. And it seems that when I've asked them these questions, they said, well, we have the very same concerns. And I'm going, yeah. And so if you have the very same concerns, then what's everybody doing about it? And the impression that I have is that they've expressed those things to the governor, but somehow it's fallen on deaf ears. I don't know. See, the only thing that I get from them is that they're frustrated, and for me, not being involved in any of these governmental things, just as a physician in the community. I mean, if they're frustrated, how am I supposed to feel? I'm taking care of these patients.
Right. Currently, are any of your patients, sir, at GMH?
I don't have any patients currently at GMH, and I try to steer them away from GMH. I send almost all my patients to GRMC unless I'm called to take care of a pediatric patient, or there's a patient with that's requiring some vascular procedure, that I need to operate on a GMH, but I'm not taking care of currently. I don't have any patients at GMH.
And in your conversations with either Dr. Cabrera or Dr. Cruz or anyone on the physicians advisory group, has there been the question of what changed as far as the plans? Because from my understanding and what was shared early on in the pandemic was that non-COVID patients would be, as what you're apparently doing, sir, with your patients, is they would be routed to GRMC, which
Correct.
would then allow GMH to care for COVID patients without worry of transmitting the disease as you're, which is the concern that you're raising.
Right.
Has that conversation of how the plan changed, has that come up?
No, I mean, actually, I've never discussed. Quite honestly, I haven't. I've never reached out to them before this. It's only recently that I started reaching out to them because I'm concerned. I'm concerned about what exactly is the hospital doing about, hospital-acquired infections. I understand that they need to look into it. I understand that they need to investigate it, but in addition to looking at it, looking at what was the cause, you need to be doing something about it. You need to, clean house. You need to look at your equipment. You should get everybody tested. You need to decrease the risk of those patients that are there. It's not like we're operating on a vacuum. It's not like we don't have any options, because if we've already decided that GRMC is supposed to be the non-COVID hospital, I think my understanding is that, there's room to transfer those patients, those OB patients, those pediatrics patients to GRMC. And if you transfer those patients there, that gives you extra room at GMH to take care of the COVID patients, because that's space that is being occupied currently. And there was also an issue in regard to staffing for those patients, but I don't see that as an issue. I mean, it's not like, GMH. I drive to GMH, I drive to GRMC. It takes me about 15 minutes to drive between the two hospitals. It's not like GMH is in another state. We're relatively close to each other, so that if you need more employees, let's say you have your pediatrics nurses that are normally working at GMH, working at GRMC at this time, or the OB nurses that are working at GRMC. If you need them and there's no patients there, then bring them back. Bring them back and utilize them at GMH. I don't see that as being a problem. 15 minutes away if you need them, that's not a big deal.
Right. And sir, kind of going back, speaking to your own personal experience and what you've seen in I think you've been a doctor on Guam for over 30 years?
Yes, yes.
And
I came back. I came back to Guam in 1992. So I've been back since 92. And initially I was at Naval Hospital, and then from when I got out of the Navy, stayed, and I've been in practice here ever since. I've never seen anything like this before. I think certainly many of the physicians have never seen anything like this before, not only in Guam, but also in the States and the world. For us, I think that having a hospital like GRMC is, I'm not trying to advertise GRMC. So that's the first thing. I'm not trying to do that. I'm looking at the situation that we have here. We have two hospitals. We have one hospital that's currently taking care of a lot of COVID patients, and we have one hospital that is free. So if you have that option, you ought to utilize what you have.
right. And again, Doc, going back to your experience, when you talk about infections in a hospital,
Yes.
can you speak to, the rate with which that happens, or at least that you've seen or experienced occurring? Because I'm assuming that it is a possibility. So, how often does it occur, and what steps do you
Okay.
typically take to, in other
Okay.
types of infections? I mean, the vector is different, but the process I would assume is the same in terms of quarantining and isolating specific patients.
I think the data that I'm aware of in terms of nosocomial infections or hospital-acquired infections is that the one that I remember is a study that was done on 10 British hospitals, and they looked at the infection rate of patients who have been acquired the virus during their hospitalization. And my understanding is it ranges from 12.5 to 15%. That's the infection rate. That compares to what we have. I mean, what the information that I have that the advisory group is putting out is that currently the infection rate in the community is about 5 to 7%. So if in a study, the data that we have is that the acceptable infection rate in a hospital is going to be in the range of 12.5 to 15%, or twice what it is in the community, then that's the range that we should be looking for. I don't know what it is at GMH. I have no idea, and I don't know if they've looked at it. But I think it's important to know what it is. And everybody should demand to know what it is. When I see that there's a business in the community that reports that an employee has turned positive, and they shut the business down because they're concerned about infecting others in the community. Yet we have a hospital that has a patient that acquired the virus during their hospitalization, and no one says anything. It's business as usual. Listen, we're requiring the businesses to shut down, and the hospital gets a free pass. There's something wrong with that. That's not right. We need to be able to ask these questions because, hey, the public should demand this, and they deserve this. The thing about the nurse, this nurse dying at GMH. The thing that's sad, I mean, certainly it's tragic that she acquired the infection and she died. What is even more tragic is that she acquired this infection in the hospital. That's even more tragic. Certainly the fact that she died is tragic, but even more so, the fact that she acquired this in the hospital is terrible. And yet we're not doing anything about that.
Right. Well, GMH has said that they're investigating it.
I know, but that's not enough. I mean, yeah, I mean, how are you investigating it? What are you doing about it? That needs to be made transparent.
Okay. So if your questions to sort of the GMH administration is, what is the process of the investigation that's followed, yes, right? And will there be, sorry.
And what are you doing? I mean, being transparent about the investigation is important, yes, but you also have to include, and you also have to explain what else are you doing to help mitigate or to prevent this from happening again, to decrease the rate of the infection, to decrease the risk of the patient who is in the hospital right now from getting the virus during their hospitalization. What are you doing about it?
Okay, all right. And so far, it's safe to say that you haven't received a response that sort of satisfies your query.
No, as a matter of fact, I text Lillian and I wanted to know, what's going on with this, and nobody's responding.
Okay. All right, sir. So, I mean, we'll certainly raise those questions ourselves. I mean, I know a lot of readers, like you know, have seen your posts, have seen the conversations with you and other doctors, and they're just as concerned about you know their loved ones being in the hospital that is currently supposed to be the COVID hospital. So,
The,
yeah, was there anything I wanted to give you an opportunity to kind of close out the
you know,
conversation?
the thing is, I don't want to wait for the next patient to die. We have a responsibility. I'm a healthcare provider. I have patients. And I have a responsibility to my patients to make sure that they are taken care of and that their risk of developing the infection is decreased, and that they don't get sick. Um, Unfortunately, people get sick, and we have to deal with that. So if people do get sick, then we need to be able to take care of them. GMH is currently the hospital that's been designated as the COVID hospital. So that means that they're going to take care of those patients. But the patients that are there who don't have it should not be subjected to the same increased risk, or there should be some means to prevent them from getting the infection.
And at the very least, that's part of your question is how is GMH doing that?
Yes,
Particularly
exactly.
in light of the recent passing of
Exactly.
the nurse. Okay,
Exactly.
all right. Okay, sir. Those are all the questions that I had for you. Well, actually, there is one more. What would you recommend to GMH? What would be your recommendation to ensure the safety of patients like yours or people who are concerned about their loved ones who are at GMH at this point?
Well, I think there's three things that need to be done. One is we need to transfer OB and pediatrics to GRMC. Two, everybody needs to be tested. Three, there needs to be a clean out from top to bottom. Equipment, ventilation, all those things needs to be done. And if you don't do those things, I think that the environment in which the patient received the infection is still the same. So the infection rate will remain the same. And the risk for infection for those patients who don't have the virus will still remain the same. I think that we shouldn't be waiting for the next patient who dies. I think we need to be proactive. We need to do something right now. And the longer we delay, the greater the risk.
Very good, sir. Again, thank you for your time, sir. And you know, if there's anything else that you'd like to share, please feel free to give us a call. I appreciate your time and sharing your concerns because, as I said, I think it's shared by many people, and you are certainly a person of authorization or who's qualified to speak on this field. So I appreciate your time.
Thank you, Oya.